And another question I had too is like, there's always like uncomfortable truths with every specialty or, provider I talk to. Is there one specific to like sports medicine or regenerative orthopedics that, people don't talk about, but maybe they just need to say it out loud? It might be in their brain, but just no one's has it in discussion.
Yeah, rest is usually the wrong answer would be the big thing. And so that's one big thing, that it's different if you're augmenting your athlete's training so they can do different things while you're resting and recovering, or I shouldn't say resting, you're actively healing the injured area. A lot of times the old notion is, well, just rest for 6 weeks and you'll get better, or don't do this, and without any rhyme or reason. And I think that's really been the biggest thing. Is the flip side of, sometimes I have to protect you from you. And I tell this to athletes sometimes, that they don't want to shut it down in one way. And I said, you've overtrained in one area and you've undertrained in another area. And now that overtrained area is injured. So we have to dial that one back so we can have you get better at the undertrained area. And so having them understand that dichotomy and being able to appreciate that, I think is huge. And so that's been the biggest thing. And another one is ice and anti-inflammatories will cure everything. Now, if you take that out of context, then that's a pretty good soundbite. But if the challenge with ice and NSAIDs like ibuprofen and things like that is, those are anti-inflammatory. Those are really managing symptoms. If you look at PRP and stem cells and shockwave and things like that, those are pro-inflammatory responses. I want good blood flow in there to help you to heal faster. You're taking Advil or you're taking Aleve and you're putting ice on it, that's to manage your symptoms. That's really not doing anything to help you heal. We take it on the other side, that we want actually to get out the bad inflammation and put in good inflammation. And that's the key component to help you heal faster. The ice, the corticosteroids work the same way. Corticosteroids are a potent anti-inflammatory. There's been numerous studies that show that corticosteroids are damaging to your joints when they're injected. So that's a very old school way of thinking. Well, we'll just put a steroid injection, see how you are. I'll see you back in a couple of weeks. If you're not better, then we'll send you to therapy. And if you're not better there, we'll send you to surgery. By that time, if we're going the route that we do, they're back doing their things that they want to be able to do, right? If their recovery is 3 months and we're getting people back to start to do their work in 6 weeks, I mean, without surgery, right?